And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Give me that care, sweet love. Give me that care, sweet love.
And welcome to the show. I'm Zach Spencer, and we're going to be talking about a subject that affects pretty much everybody. If you're not a snorer, you might live with somebody who snores, and it's an issue beyond just the noise and keeping people up. And joining me in studio today is Dr. Charnel Muir, the SnoreDentist, which is a great moniker.
Thanks.
How did you come up with that?
You know what? We played with a bunch of different things, and we thought, you know what? That's the thing people are going to remember, and it's the thing that affects so many people that really snoring is catchy for them to focus on. Now,
a lot of people listening, maybe hearing you for the first time on the show, are wondering how you connect snoring and dentistry. And, give us a bit of background about yourself and how you ended up in this line of work.
Right. So my first degree is in dentistry, graduated at UBC with my Doctor of Medical Dentistry in 1987. So this is my 30th year in practice. Went on to focus a practice on what's called, or what developed as a field called dental sleep medicine. So I had a general practice to begin with, and then slowly geared my practice towards this field as it developed. Because really it's a field that's only developed in the last 20 years or so.
I was going to ask you, so 30 years ago, you become a dentist, you're out practicing, and this wasn't really an avenue at that time.
It wasn't. It was just developing at the time. It wasn't a field of its own at the time. It was something that we knew about. It was something that was developing. But I've been involved in it since its inception and watched it develop and been a player in it as far as treating patients, watching the development of different appliances, and have always had a passion for the fact that we can affect, those of us trained in dental sleep medicine, we can affect the health of our patients far more dramatically than we can perhaps just fixing a cavity.
Okay, so let's bridge that snoring and dentistry. So what are you doing for somebody who snores? And it's not just snoring, it's sleep apnea, right?
Right. So, there's a lot of information out there now about the sleep apnea world because we know so much more about it. But people will certainly have a lot more exposure to snoring on a daily basis. Whether or not they have exposure to sleep apnea yet, it would be less of the population, but snoring is definitely out there.
You have a stat on that, don't you? About
apnea? I brought this because it's the American Heart Association's recent, they did an article called Sleep Duration and Quality and the Impact on Lifestyle Behaviors and Cardiovascular Disease. And they basically estimated prevalence right now is 27 to 34% of men between 30 and 70 years old have some degree of sleep apnea. And it's increasing year by year, 9 to 28% of women in that same age bracket.
And so make that link from sleep apnea to heart conditions.
Right. So the sleep apnea itself has two components. One is that it will cause a fight and flight reaction in the body. So you'll get increased in heart rate, blood pressure, stress on the cardiovascular system. And then it also has an oxygen deprivation component. So every time you don't breathe, even good snoring can affect this. You will get a drop in your oxygen level. So at night, during the day, you've done damage to that heart and you're expecting it to pump. And say at night, it's pumping, it's trying to pump as a heart rate, and you're not feeding it enough oxygen. And you're asking that muscle, because that's what the heart is a muscle, and you're asking it to exercise every time it pumps, and you're not feeding it a lot of oxygen at times. Yeah.
So a high percentage of people who snore have sleep apnea?
It tends to be a continuum. We do have patients with sleep apnea that don't snore, but snoring and heavy, consistent snoring is certainly one of the kind of precursors to a vast majority of people that have sleep apnea, but it tends to be a continuum that we call sleep disordered breathing. So for a number of people, they'll start with what's called situational snoring. They'll start snoring either only on their back, or they'll only snore if they've had some alcohol in the evening, or, they have a cold, or their allergies are acting up. So something causes the situation. But what it's telling us is that they have the underlying physiology, which is prone to snoring. It's just that at the beginning, it just needs something to kick it over, and it shows up, right?
So when you're snoring, that flapping of the soft tissue in the back of your throat is, I guess, when it's flapping back and forth, it's closing and opening, right?
Right. So as the tissues vibrate, the vibration is often caused by the fact that the tissues are relaxing. Mm-hmm. They're getting closer together. And then in order for the same amount of airflow to go through a narrower tube, it has to go at a faster rate. And that can cause air turbulence, and the air turbulence causes the tissues to flutter. So as those tissues flap, they can limit the amount of airflow going through. They can cause quite loud noises, and they can cause swelling in the tissues. A number of my snorers will come in at the beginning and say, there's some mornings they know they've had a bad snoring night because they wake up thinking they've got a sore throat and the start of a cold. Mm-hmm. And it's really just the swelling or inflammation in the tissues in the throat.
So I kind of threw you off a little bit because I was asking about other things. So let's connect the dentistry and sleep apnea / snoring. So what is it that you're providing for your clients?
Right. So what I do for patients is what's called oral appliance therapy. And oral appliance therapy can be certainly a first-line therapy for snorers. It can also be a first-line therapy for mild and moderate sleep apnea. And then it can be the second-line therapy for any patient who is CPAP intolerant, which is the other therapy that patients would use as a CPAP machine. So the oral appliance has a wide array of patient base, and what they do is they're going to help manage that airway by helping it stay open so that the air flows more freely while they're sleeping.
So describe this apparatus that you have to wear in order, and the amount of movement to open the airway is really quite minimal, isn't it?
It is. So for most patients, their lower jaw will move forward to back anywhere from 8 to 10 millimeters is an average. Let's
do it right now because people are listening on the radio and maybe in their car. So describe it.
Right. So picture a 1 centimeter on a ruler.
Right.
So if you bring your lower jaw in front of your upper jaw teeth, that range or movement will be about 8 to 10 millimeters for most people.
So your bite is your top teeth are over your bottom teeth.
To start.
And then you bring the bottom teeth so they're
edge to edge. Edge to edge. Right. And then most people can even move their chin out farther than that. Mm-hmm. Right? Like the bulldog bite where your bottom front teeth are in front. Mm-hmm. So for most people, their jaw will move forward and back. And for any of the listeners who have done CPR, for instance, if they come across a patient, they'll move that lower jaw forward to see if that enables the patient to breathe, to determine whether or not there's something in the airway or whether just the collapse of the airway is causing the obstruction.
So how many people come into you because of the noise, and how many are coming in to you because of apnea, or they find out they have apnea after they've come in to see you about snoring?
Right. So about half of my patients come in based on snoring as the chief complaint. Mm-hmm. A fair number of them are actually sent in. The spouse, the bed partner, the family, the traveling person, whoever has to share the cruise ship room with them, anything like that. Grandchildren will send grandparents in, so we get a number of patients that come in based on the snoring itself. Mm-hmm. Now, at that point, we have to determine whether they only snore or whether they snore and or have some degree of sleep apnea, but that's, the next step. So they get sent in for the snoring because the noise is disruptive for other people. Mm-hmm. The other half of my patients will come in based on daytime tiredness. They're coming in because they're fatigued. Their physician might send them in. They don't know why they're tired. Or they come in because they already know they have sleep apnea and they have failed or don't want to try the CPAP machine.
Right.
Yeah.
And so describe briefly the test that you do, because in the next segment, we're going to talk about how I took the test. So how do you determine the amount of snoring and possible sleep apnea?
Right. So the home sleep monitor that we use is what's called a level 3 monitor. So a lot of people will be familiar with the finger probe monitor, the one that monitors your oxygen. Mm-hmm. That used to be the home test that we use. And now we can use a far more advanced home monitor. And the home monitor that we use now will measure the finger probe heart rate and oxygen, but it's also going to measure how many breaths you take using an effort belt or an elastic belt that you wear around your chest. And then it's also going to measure your airflow using one of those nose cannulas, those oxygen cannulas that people will wear if they happen to be getting oxygen or if they're in a hospital. Ours, however, doesn't blow any air or oxygen. It's just picking up your natural airflow.
Right. You're breathing.
Yeah. So it's going to pick up breathing. It's going to pick up position that you're in. It has a little compass in it, and it tells us what position you're sleeping in. It's going to tell us airflow. It's going to tell us whether you're trying to breathe or not. It's going to tell us heart rate, oxygen, any number of those monitors.
That's the voice of Dr. Charnel Muir, the SnoreDentist, and we're letting you know today that snoring obviously is an issue. It's noisy, but it also, for many people, is a sign of sleep apnea.
Yes.
And you need to get the test done in order to get fitted for an oral appliance. Now, when we come back, I did this sleep test, and I haven't seen or heard the results. Dr. Muir is going to go through my results, and I'm sharing them here with you. Very personal. I do snore. I've been told I snore. I've never heard it myself. But
some people do. Some people snore themselves awake.
Well, it's interesting because you mentioned, is it worse if you have a cold and you can tell I'm stuffed up? But my wife went and slept with my son in his room because I had a bad cold, and she said, "Oh, it was so loud,
so much worse,
so much worse." So, but that's typical, though, isn't it?
Yes.
If you're stuffed up.
Yeah.
So, what we're going to do is we're going to come back after the break. We're going to reveal the results, and I'll talk a little bit about how it worked and what the experience was like. Next, we're talking about the SnoreDentist, Dr. Charnel Muir. If you sleep better, you live better. Or you maybe even live longer. In some people.
For sure.
All right, next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.